Good afternoon. Thank you and welcome to my presentation. So only 15 minutes, isn't it? All right? 15 minutes, yeah, thank you. So I have to go quickly, otherwise I cannot finish. So now we're talking about global burden of surgical disease. And Aussi Bangla Smile, it is one of the charitable voluntary organization from the Sydney, Australia, which I am leading for the last 10 years. And a small positive step from Australia have some positive impact on the global health. So currently I'm one of the GP registrar, Akram GP registrar, working in Tamworth, Manila. But before that, I was a plastic surgical registrar in a Nepean hospital. I worked about more than 10 years. And also my background, I was a pediatric surgeon from Bangladesh. I have a special interest on cleft lip and palate surgery. And just have a look. This is the project running through the Rotary International and the Nepean Hospital, all of my colleagues from the hospital. So just going to start about the few talk about the global health and surgery. Surgery is basically essential component of the healthcare system. A recent study shows that 11% of the global health and global burden of the disease can be treated by the surgically. But if you see the difference between the surgical disease, surgical management of the developed world and developing country, just an example, in the United States, about 21,000 operations happening for 1,000 population. But in the same time, like Bangladesh, one of the developing countries, there is only 192 operations happening for 100,000 population. So 70% of the world population, they don't have any emergency, essential surgical care service. That means out of 7 billion people in the world, 5 billion people, they don't have any emergency and surgical essential care service. And if we just think globally, we find out there's more death and disability from surgical treatable condition than the HIV, tuberculosis, and malaria. And 25% of the hospital admission requires surgery. And trauma is the major cause of the death and disability in the current situation. Just come back to my organization. It's called the Aussi Bangla Smile. Aussi Bangla Smile, a voluntary medical team which established with the help of Rotary Club of Nepean, that means New South Wales, and also it established in 2007. Doctors, nurses from the Nepean Hospital, we established this project with my initiative, and I'm leading this team for the last 10 years. We do a lot of reconstructive surgery. So team is consists of basically the surgeons, anesthetist, scrub nurse, scout nurse, anesthetist, medical student also, and also similar type of medical team joined from Bangladesh with us. So this is the team is ready, sorry. Oh. So team is ready to fly. So main aim of this project to serve the underprivileged children and patients who have no access to the surgical service, and to provide and training and share our medical knowledge with the other local doctors and team. And also at the same time, we'd like to engage the Australian health professionals who have a strong desire to do some humanitarian work. Before you go to the other country, we need to raise some fundraising. Because our team is very small, we are not getting any big funding from other organizations, but we get some good support from local community, our team members, our family. So we organize some trivia night. Every trivia night we can raise about $15,000, and each project cost is about $30,000. All the team members provide their own airfare and their own annual leave for 2 weeks. So every operation cost is about $250, and this is we can see the operation happening in here. This is the trivia night, so we can organizing lots of people are coming, they buy the ticket, we get the money. And also, we organize some fundraising, and Look, have a look. I have to dance with other girls. That's a part of my other job. So just talk about a little bit about the Bangladesh. It is one of the Southeast Asian country, and I'm from there. This is my background. So population is 160 million people, and the country is just about a little bit bigger than the Tasmania. So people is everywhere, and the life expectation is about 65 years. Median household income is only about $162 per month. Hospital bed ratio about 3 per 10,000 population. So have a look at the country looks like that, lots of people everywhere. And basically we go from there, from Dhaka is the capital, go to the remote hospital. Remote hospital means it takes about 5 to 10 hours to go by a local bus. So this too is the hospital. This is one of the remote hospital, about 8 hours away from the capital city, and this is another hospital. This is the boat. The floating boat is the hospital. So we go there, we stay there for our 14 members team, and this boat has another medical team working over there. So that is the boat. So the patients coming over there, we stay for 5 days. In the third, we stay for 4 days, one occasion. We did 39 cases. So here and there, what's the difference in Australia? In Australia, in theater, we get lots of gas supply, the pipe gas supply, no cylinder, reliable power supply, lots of ventilator, everything well equipped, ECG, blood pressure, carbon dioxide monitor, everything is up. You can see the picture in here. But in Bangladesh, sorry, I put the wrong button. In Bangladesh, there's only the place we are operating, it is a remote hospital, so we have to do it with a cylinder only gas supply, power interruption, no ventilator, we use a pulse oximeter and blood pressure monitor and our clinical knowledge and clinical things. Everything depends upon a clinical skill. The skill is very important. So we do these types of operation with that minimum support. This kid just operation finished just after, still in the recovery. So lots of children are coming. The local hospital organized about lots of children, all are waiting for the operations. So why the cleft lip and palate? Just a little bit of the things. Incidence of cleft lip and palate is about 2.5 per 1,000 lip births all over the world. Maybe the developing country is a little bit higher due to the malnutrition, but the incidence all the same. So different type of variations of presentation. Some kids are present with a simple cleft lip, some patients present with a complete cleft lip, some patients with a big gap in the palate. It's called the cleft lip and palate. So problem with these children, probably have not seen these types of children in Australia because everybody is repaired down within 1 year. Cleft lip, palate, everything's done within 1 year. So you have not seen that. But the developing country like Bangladesh, India, other country, there's lots of adult cleft lip palate because they cannot afford the surgery. And government also not able to put the surgery. So our main challenge for the operation, because we operate in the children. Anesthesia is a big challenge, and recovery is the big challenge, and we need to make sure tube is gone through the tube. So our Nepean Hospital anesthetic head, Dr. Sue Tan, she's always going with us. She's also teaching our Bangladeshi anesthetist, make sure the tube is there, and always the education is involved. So anesthetist is happy. He's pushing the bag under the draping tray, cloths. So this operation is going on. So the few story we would like to show you. Look, this is another complex cleft lip patient. This Regina, a 16-year-old girl who first appeared in our project in 2013. She had a large facial cleft palate and cleft lip. We operated in 2013. After the first operation, he got a little bit better appearance. And after that, he got back to the school and integrated into the society. We're talking about some complex cleft lip and palate operation. So this is the Sharmila. She came at the age of 6 months of old. She had a very bad facial cleft coming from eye up to the lip, both sides, and she cannot close the eyes. So what happened? One eye go to the exposure keratitis, and she got blind. Other eye, about 30% gone to the exposure keratitis, but still he can see in the upper part of the cornea. So we did the repair, it takes about 4 hours. After the first repair, he looks like that. After 1 year, she looks like about that. Then after the next operation, we do another reconstructions of the lower eyelid. So we involve the eye doctors, organize the operation of the tear duct. So a lot of other team need to be involved. So in the last 10 years, we have done 776 operations. And we did about 8 missions. Some of the missions we missed. So 60% patients are below 5 years of age. And 40% patients are older than 5 years. And older people who are more than 15 years, 10 years, like this young chap, we did the operation under local anesthesia. This operation done under local anesthesia. It takes only about 1 hour. Then this picture taken in the same time, just after, within the operation table. So every muscle, everything is there. We just need to know where it is. We need to connect. That is the surgical technique. But the operation is not too much difficult. It cost is only about less than $50 if you do under local anesthesia. So this lady is waiting for 55 years, like that. So this is operation also done under local anesthesia. This picture taken the next day. She's so happy. So this mother realized that this is not only such a simple operation, but these children now have opportunity, have some future. They can integrate it in the society and have some impact in the country. We also do a lot of burn contracture because the high-risk environment, open fire, cooking, and poor electrical safety, flammable cloths, so lots of significant functional impairment in the hand, in the foot, and in the chest wall. So you can see how the bad contracture happens. So we can release the contracture and do the skin graft. Then after that, we hand over to the patient to the local doctors. Local doctor look after this thing, and physio people, they got some little bit of the functional improvement. So this is the 10 years old female who have a thermal burn in the chest, axilla, abdomen, in the groin. So we did the operation 3 stages. We operated in 2013, 2014, and 2016. So team has a very big hectic time for 2 weeks. So they have to work for 8 o'clock until the 8 p.m., 12-hour shift. And it's very hectic. So we have to make sure the team got a good food. And also have to make sure that they got a good security. So because sometimes government also gives us very good security. So when they're moving from one place to another place, so there are lots of Army Medical Corps, they help us. And also, we have a very good time. We have to dance with the patient. Last day, we have been dancing. Our team leader, Barbara Mitchell, she's an excellent nurse. She spent every day about 10 to 5 hours for this project. So she's dancing with one of our burn victim patients. And we have a lot of dancing at the end of the day to make sure everybody is happy. So team come back with a great satisfaction and with a new idea, a new project. So we started another new project for the women's health. So we thought we should increase some help for the women's health. So we start another project 2012 with the help of Rotary Club, Rotary Worldwide Community Service, to help the women who are suffering from some vaginal fistula and some uterine prolapse. And my brother is an anesthetist. He helped me. So in the first year, so they did about 161 BVF operation, vaginal fistula. I'm sure you know this thing. And prolapse uterus. Prolapse uterus is very common. The mother has multiple children, childbirth, and they got some prolapse uterus very early stage. So this project was so successful that this project is taken up by one of the Australian charitable organizations called the DAC Foundation. And in that project, that project, till now, last 5 years, 7,500 operations done for the women. So our core project is Aussi Bangla Smile. We did only 800 operations, but this project was so good, they have done about 7,000 operations because women need so much help. And our project funder, DAC Foundation, they thought that they're taking this project to the Africa and other countries. So the DAC Foundation is a very good charitable organization in Australia. So they do a lot of work without any publicity. Probably don't know. So as because this morning, the Jilly farmer presenting that how the world looks like that. Thank you. So I thought that we have to stop now. So thank you very much for listening to my project. And I have just one slide. So we do another one project to start the Days for Girl, international charity organization. We provide the reusable, washable, sanitary kits for the women in the refugee health. So if you like to see the poster, there's one poster outside, you can have a look. That is the project for the refugee health and for the women. Thank you. So we stay locally, we think globally.
Thanks for that. It was really inspiring.